morning, everyone. And thank you all for being here today to discuss something that is extremely, very important to not only our entire state, but in particular to our seniors and their caregivers. It's really the family of Connecticut that is impacted. As you've seen earlier this week, the governor has come out with his version of a budget, and once again, he's cutting home care, the Connecticut home care program, among other initiatives. That is just a poor policy choice. Early this morning, as well as yesterday afternoon, we started to hear the news of a bipartisan budget, an agreement among the General Assembly caucuses that is coming forward. And at this time, now more than ever, it's so important to advocate for the families of Connecticut, for the seniors of Connecticut, and for their caregivers, because this program is in the balance. And what I think we need to do is look at a little of the facts. Right now, we're spending about 10% of the state budget on long-term care for 14% of our population. If we keep going at this rate, it's shown that by 2032, the numbers of seniors will increase by almost 70% in the state of Connecticut. So there's going to be exponential growth in this population, and if we keep it the same percentage, we're going to be spending almost $5 billion of state money in this area, and that is not sustainable. So what we want to do is to go and look at an alternative, and the alternative is a robust, healthy home care industry. The initiatives, however, that this governor has taken for the 7 years that I've been in the legislature have done a lot of things to dismantle that program. We are seeing a reduction in long-term care beds, and now we're seeing the erosion of the home care industry. What are seniors going to do? I think these types of initiatives place people at risk. And so what I'd like to see happen in the budget that comes forward is that we protect this. And we protect it because this is what people want. When you talk with seniors in Connecticut and their caregivers, the percentage of people that want home care isn't just like the Bush-Gore election where it's 51-49. The numbers are unbelievable. It's more like 90 to 95% of people want to age in place. We know that if we're going to make a Medicaid appropriation, that the cost in the community is about a third of what it is in an institution. So it's less expensive, and it's better. So if everybody wants to do it, it's less expensive and better, why aren't we doing it? That is just the smart policy, and it's why we're here today, to send that message at this time in Connecticut's history, when these programs are on the chopping block. But to send that message to Hartford to make sure that we don't lose these smart policy choices. It is just common sense, it's good public policy, it's good human services, and it is the decent thing to do. So today I'm joined with a bunch of friends, neighbors, familiar faces. I'm very fortunate to have this support and to have these individuals with us. And a few people will now speak. First is from AARP, Jean Karen.
Thank you. Thank you, Senator Kelly, for having us here today, and thank you for being a champion for this program. Connecticut Home Care Program for Elders, in my mind, is a critical program. For the last 5 years, my mother was on the program. She passed in January at the age of 97. However, up until that point, I had the peace of mind to know that she was safe in her home. She received services, VNA, Meals on Wheels, companions and homemakers, and it kept her safe in the house. Just a quick sidebar. Before we were on the program, one day I had arrived at the house and learned that she had taken 5 days of her medication all at once. Well, once I got her on the program, she was being monitored by wonderful people who really cared for her, not just as a nurse practitioner or a companion, but really became almost part of her family. It kept her in her home, it kept her safe, and the expense to her was de minimis because at that point the copay was a reasonable amount. The fact that they want to get rid of this program to me is absolutely devastating. She lived in senior housing in Old Saybrook, and there were many, many other folks who were on this program as well. And to see this go away, to me, is just crazy. As the senator said, it costs a third of what it would cost for my mom to be in a nursing home. And she's home where she wants to be and safe and well taken care of. It also kept me healthy. As a caregiver, we really have to be very cognizant of our own health. When she first wound up with a very serious heart attack, it hit me really hard, and I had to scurry to find help for her. The stress of that made me ill. But having the program and knowing that she was well taken care of really alleviated a lot of the issues that I faced. So please, please, we must keep this program going. And again, thank you so much, Senator Kelly, for your support. It really has been amazing. My mom thanks you, too.
Thank you. Next, we have Mary Therian, who is President and CEO of the Stratford VNA.
Thank you. I'm here actually today to speak on behalf of the entire Connecticut Association for Healthcare at Home. Home health care has gained significant importance in the Connecticut state budget debate, as home-based patient care is the preferred, highly cost-effective, and proven savings vehicle for state taxpayers. Any reduction in the state's Medicaid budget line item, particularly for seniors, will dismantle a system that is working effectively and creating a cost savings of $100 million per year by providing Medicaid clients care in the home and community settings, as opposed to more costly institutional care, as we've heard from the other speakers. State data from the Department of Social Services indicates that home and community providers have saved the state budget more than $1 billion between 2006 and 2016 by transitioning Medicaid clients from nursing homes and hospitals to home-based care through the Money Follows the Person and other programs. Our Medicaid system is fragile. Home-based providers have not received a reimbursement increase in 10 years and are required to do more with less. Providers are opting out of the Medicaid program, and currently that truly is happening around our state. Providers are access to home-based care for our most fragile state Medicaid beneficiaries and seniors is becoming a challenge, jeopardizing a system that is working, filling a vital need, and at significant cost savings to the state. Just recently, they enacted a 15% cut to the state's most Medicaid home care patients, the most needy patients that are in our community. Those patients that have what they call add-on services, meaning that they need a higher level of care or they live in high-risk areas. They're the most likely to have some sort of a system failure if they don't get care at home. That has made it impossible for some of the larger providers who have been the safety net for these patients for many years, has made it impossible for them to continue to provide services for those patients at home. We really need the support of everybody to make the governor and the legislators understand how important home-based care is. Obviously, patients, if they're not going to receive home-based care, are much more likely to go to the emergency room, are much more likely to be admitted to an acute care hospital, which is even more expensive than long-term care, and then go to long-term care in addition to that. Thank you.
And thank you, Mary. What Mary was putting a face on there was the value of caregivers. We are talking a contribution of billions that is done because of the love, the care, and the compassion that they have for their family members and for our neighbors. And what the state should be doing is looking to partner, to collaborate, to support such initiatives, because that is what people want. It's the best route, and it's the least expensive one from a fiscal perspective at the state. But it is worth millions, and the value is priceless to the family member in need. So that's part of this focus, is to stay focused on what is important in Connecticut. The next person I'd like to call is Matt Stillman from Connecticut NALA.
My name is Matthew Stillman. I'm an elder law attorney. I'm here as the immediate past president of Connecticut NALA, which is an association of elder law attorneys in the state. Senator Kelly himself is an elder law attorney. I would like to thank him and acknowledge his efforts, and we urge the legislature and all parties to continue these home care programs. Without getting into the specifics, home care programs, as he said, are significantly less expensive for care for our seniors and our disabled individuals than institutionalization. Our organization, of course, continues to work with seniors, disabled individuals, veterans and their families, and we urge the continuation and possibly expansion of these programs, as this will be a sound fiscal alternative to forcing all these individuals who are able to stay at home at a significantly lower cost from being institutionalized, which will cause significantly higher costs and, of course, significant interruption in their own personal lives and their families' lives. Senator Kelly, thank you as always for all that you do, and we urge people to ask their legislators to support the continuation of these programs. Thank you.
And thank you, Matt, and for all that advocates do on behalf of our families across Connecticut. You know, I came to the legislature about 7 years ago in January of 2011, and at my first press conference that I ever attended, at the time I was ranking member on aging, and the chairperson of aging was then Senator Edith Prague. And the one thing that Edith, Senator Prague, imparted on me that has stuck with me to this day is that when it comes to aging, it's not about politics, it's all about people. That's what this is about. We're not looking for a partisan solution, a Republican or Democrat solution. We're looking for the right solution, the right policy for our families, the right policies for seniors, the right policy for caregivers. We believe that home care is the way that we need to go forward. Aging in place is what people want. And if everybody wants it, it's less expensive and better. I ask, why aren't we doing it? The governor's failure to put this in his budget was his mistake. What I would like to see going forward is that it remain not only in our budget, but in the bipartisan budget that is being discussed right now in Hartford. This is the best policy. It's the smartest policy. So let's push this forward. Let's get the word out to people that home care is important. It's important to the entire state, but it is so valuable to the people in need and the caregivers who help them that this is something that should be at the top of our legislative agenda, not at the bottom. Once again, I want to thank from the bottom of my heart everybody who's been here today, because you recognize how important this is in people's lives, and it's important to make sure that we get this message out. Thank you very much.